I can't make his name somewhere. All right. Well, thank you all very much for joining us here this afternoon to talk about what the state is doing to prevent the spread of coronavirus here in Nebraska. So we are on day 19 of 21 to stay home, stay healthy, stay connected. And as always, I want to remind everybody with regard to our 6 rules to keep Nebraska healthy. First of all, stay home, no unnecessary trips outside the household. 2, work. Work from home if you can. If you're going to be in the workplace, please socially distance, that 6-foot physical distance from yourself with other people as much as possible. 3, shop. But shop once a week and shop alone. Don't take the whole family out. Have a list. Be efficient. 4, help kids socially distance. Keep them at home to play. Avoid group sports in the playground. 5, help seniors. Maybe you could shop for them or run their errands so they could stay in, but do not go visit them in a nursing home or long-term care facility, because we are trying to keep those folks separate from other people because they are so vulnerable. And then finally, exercise daily at home or with an appropriate socially distanced exercise. So please do those things to help keep Nebraska healthy. So our next reminder has to do with Test Nebraska, testnebraska.com. So as I mentioned yesterday, we have 2 sites that we're going to be, the first 2 sites we're going to be up with testnebraska.com. It's going to be Omaha and Grand Island. We're working to get that lab set up so that we can process those test samples. We've got 100,000 people now that have signed up for testnebraska.com, so good job, Nebraskans, but we need more, so please continue to challenge your friends at #TestNebraskaChallenge to be able to sign up. The assessment takes less than 5 minutes. It is just easy to do. It's going to be encrypted in a database. It will only be used by the state. It will not be sold in any way, either in aggregate or individually. So please sign up at testnebraska.com. And very excited to announce that if you go to testnebraska.com/ES, now the homepage is in Spanish as well. You may recall yesterday I said that the assessment was in Spanish, but not the homepage. Now we got the complete package, all in Spanish, so testnebraska.com/ES. Please, if you are someone who has connections to the Hispanic community, reach out to your folks who English may be the second language or their first language. Help them get signed up, encourage them to fill out the assessment. That will help us make sure we can get a lot of people tested when we get testnebraska.com into the phase where we're actually doing the testing. Next, so we had talked about the DHMs, the directed health measures that are expiring in April and then May and May 6th and May 11th and so forth. So we talked about starting to allow restaurants to be able to start opening, and that we're going to publish guidelines with regard to how restaurants could open starting on May 4th. So that's the same day we're doing elective surgeries and so forth. Restaurants will be able to start operating at 50% of the rated capacity with certain guidelines. They will have to, for example, have tables be 6 feet apart, no more than a party of 6 at a table, no bar seating. All the restaurant staff will need to be masked. That we're going to encourage people to have different roles. So, for example, we don't want servers taking money. We prefer that to be done actually pay in a cashless way if possible. So these are some of the guidelines that we're looking for. Patrons will only be able to consume alcohol if they're also consuming a meal. So we're going to be talking about these guidelines next, and we've got Zoe Olson, who you all have seen before. She's the executive director of the Nebraska Restaurant Association, and she is going to come up and talk to us a little bit about those guidelines. So Zoe, I'm going to turn it over to you.
Thank you, Governor Ricketts. First thing I'd like to say is restaurants that are affected first are the ones whose DHM was going to expire April 30th.
Right.
Correct? So it's not for the entire state, and this is reopening dining rooms. Okay, so we've been under takeout, delivery, and carry out for a while now. So together with our members, the National Restaurant Association, and a lot of subject matter experts, we developed what we call our opening response guidance, and you can find this on our website. And so these are best practices for all our restaurants to use, okay? So you can find this there. Secondly, we'll be also posting in our restaurants, as you come in, the reopening guidelines, the requirements of the DHM, and it'll probably look just exactly like this, okay? And we'll be also posting the Nebraska Promise. And the Nebraska Promise is twofold. It's the promise that your Nebraska restaurants are making to you, our guests. But also there's a part for our guests to make a promise to us. And the promise that you're making to us is that you will not come into our restaurants, into our dining rooms, if you are showing any symptoms of COVID-19, if you have a fever, anything like that, because our staff is incredibly important to us and we need to keep them safe. And so if you think about it, our staff are going to see more customers than customers are going to see staff. And so we just want to encourage everybody to go ahead and look at what the restrictions are, and that's what's in the DHM, and then what our guidelines are, which are best practices. And understand that we're doing absolutely everything we can to make this the safest environment it can be for the consumer. And we've been working on this while our dining rooms have been closed. So we've been moving tables apart. We've been sanitizing, which we do anyway, but now we've had an opportunity to go even deeper. And we've developed a lot of procedures that are going to be in place as we move toward reopening and then hopefully expanding. Thank you.
Zoe, these guidelines will be posted at the restaurants too,
Yes,
correct?
there will be a sign that's going to be red in color, surprise, and it's going to be called the Nebraska Promise. And then we will also have these, and these will be posted as you enter the restaurants. Okay, so there will be 3 pieces of paper that you'll see, or posters that you'll see posted. So you can check that out at all times. Thank you.
Great, thank you very much, Zoe. And again, just so we're clear, that the DHMs that are expiring are for Douglas, Sarpy, and Cass counties on April 30th, which we've extended now till May 3rd and May 4th. This will then be the restaurants opening up 50%. We do have other directed health measures that are expiring on May 6th and then May 11th. And then we also have some of the health departments that moved up that we announced the other day that would also be May 4th. So, again, just to your point, Zoe, all the ones we announced that the new directed health measure will begin with on May 4th, that's where this directed, or the dine-in for restaurants will begin. So if you're in one of those public health districts, you'll be able to see your restaurants start opening up with these guidelines that will be posted at all the restaurants. Now, we also announced that elective surgeries will also begin on May 4th, and this is something that also includes dental offices. And by the way, the difference between this directed health measure and the one for restaurants is this directed health measure with regard to elective surgeries is statewide. And we talked about how hospitals will be able to start doing elective surgeries with the restrictions of 30% of their hospital beds open, 30% of their ICU beds open, and 30% of their ventilators open, and 2 weeks worth of personal protective equipment. So that's for the hospitals doing elective surgeries. But this directive health measure also includes dental offices and veterinarian services. And so we have 2 guests with us today to talk about that. Dr. Kraft, who's with the Department of Health and Human Services, Dr. Tusha, who is with the Nebraska Dental Association, and they will be talking about the guidelines dentists are going to be using to start seeing patients again on May 4th. And again, that one is a statewide directed health measure. So Dr. Kraft, I'm going to call you up first to be able to talk about this, and then you can call up Dr. Tusha. Sound fair?
Thank you.
Great, thanks.
Governor Ricketts, thank you very much for this opportunity. And I'd just like to say that the coronavirus has certainly affected all of our lives here in Nebraska, and dental health care has been no exception over the past few months, as we focused our efforts primarily on providing emergency care services to patients to lessen the burden on the hospital emergency rooms. But now, as we prepare to reopen elective dental services on May 4th, the DHHS Office of Oral Health, the Nebraska Board of Dentistry, and the Nebraska Dental Association have been in constant communication, and we have pulled our resources together to review the latest evidence-based information from the American Dental Association, from the Centers for Disease Control, and the Centers for Medicaid and Medicare. We want to ensure that our message to the dental community is clear and consistent at this critical time. And we want to assure the general public that dental services will proceed with safety precautions for patients, dental staff, and providers being at the top of the priority list. Accordingly, the Nebraska Dental Association has been working hard to produce interim guidelines and recommendations for dental offices. Their final report has been reviewed by DHHS and the Board of Dentistry and will be a living document with frequent revisions as more becomes known about COVID-19. Certainly, there will be increases in universal precautions with enhanced patient screening, elevated personal protective equipment, higher levels of infection control, and limits on certain procedures. This will mean a new normal for the dental world. Private offices, dental schools, FQHCs, other dental programs, their openings may vary. The decision to reopen or remain closed is up to each dental practice. But these new guidelines produced by the NDA will assist people in making that decision. I'm confident that the dental profession can rise to this challenge, similarly as we did in the 1980s with the AIDS crisis. So with that, I'm going to introduce Dr. Ken Tusha, the immediate past president of the Nebraska Dental Association. He's a general practitioner in Knox County. He understands the rural situation and how these new guidelines can help the dental profession moving forward.
Thank you, Fritz, and thank you, Governor, for all the information and keeping us informed on a daily basis. It's very much appreciated. We have a document similar to what the Restaurant Association has. It's the Recommended Office Opening Protocols. It can be accessed on our website, which is nedental.org, and that's open to any member of the public can access this information. And be aware that, as Fritz said, this is going to be a living, breathing document. In fact, I've got that one I just held up is today's revision. This was the one from 6 days ago. So they change. And as the CDC and other entities come out with added information, we know that this is going to change as time goes on. And some of the things that we want to stress to patients is dentistry is probably not going to get turned on just like a light switch. It's going to be more like a dimmer switch. And we're going to slowly open up our offices after we have trained our assistants and our hygienists and our whole team to the new protocols. Our guidelines include the training that I mentioned and screening the team on a daily basis, as well as patients as they come in. Patients will have their temperature taken when they come in, as well as go through a number of questions. And they may be sitting in their car when they're doing this. We may be talking to them on their cell phone. So it's going to be a different world and a new normal. We're going to eliminate patient-to-patient contact when they get in the office. We won't have the crowded waiting room that maybe some of you may recall. We're going to practice social distancing patient-to-patient wise, and we won't be able to see as many patients. We're going to have enhanced disinfection procedures, and we're going to decrease the aerosol procedures and assure that everyone has the proper PPE, personal protective equipment, to protect themselves and the public. You can be assured that we're going to do everything possible, and dentistry went through an episode like this back in the 80s with the AIDS crisis, and that's when all of a sudden dentists started wearing gloves, wearing masks, and rest assured that we got this. We will beat this. Thank you.
Thank you, Dr. Tusha. I noticed you said you're going to be reducing the aerosol procedures. Does that mean that drill thing that The noise is kind of a little, really uncomfortable in your mouth? Is that, we're going to see less of that?
The noise of it, yeah.
The noise of it?
Yeah.
Oh, okay, well,
No, we're going to, that's going to be done on a basis where maybe we see those patients early in the day and then.
oh, I see. So you're going to see those patients early in the day and then, okay, very good.
Later on. And
So I'm not getting out of that. You're saying I'm not getting out of that, though?
no, you're not.
I'm not getting out of that, okay. Never mind. All right, what else do we need to talk about here today? Actually, I thought I had my sheet, but I don't have it here, so we're going to just kind of wing it here a little bit. I know we had a couple of other reminders that we wanted to talk about. First of all, there was the, yes, is that the sheet there? Zoe took it. Zoe took my sheet. That's what happened there. See, well, actually, Zoe, what you should have done is just see if I actually could remember everything that was on my sheet and wait till the end to say, by the way, Governor, you forgot this. So we got through the dental guidance. Family First Coronavirus Relief Act became effective April 1st. And one of the things this did, it extended the Family Medical Leave Act for coronavirus, and it also gave our teammates here at state government additional 80 hours to be able to take as leave if they were impacted by the coronavirus, whether it was they were actually sick or had to quarantine, if they had kids that were out of school, that sort of thing. However, it exempted some of our teammates. It exempted folks like our corrections officers, our state troopers, our 24-hour facility folks. It exempted healthcare workers, some folks in public assistance, Department of Labor, people processing those unemployment claims. It did not include those folks because those were deemed mission critical. However, at my request, I asked our Chief Human Resources Officer and Director of Department of Administrative Services, Jason Jackson, to reach out to our unions, NAPE, FOP, and SLEBIC, because what we'd like to do is extend 80 hours of sick time to those teammates who were not covered under the Family First Coronavirus Relief Act and offer them those same opportunities to be able to take that time off. Understanding we have to manage that to make sure that we can still complete our mission critical things, but we were able to work with our unions to be able to get that done. I want to thank Jason Jackson and all the folks in the unions who were able to make this happen for our teammates, so they will be able to get the same benefit with regards to those 80 hours of leave. And that way they don't have to, that way if they do get sick, they don't have to take their current sick time to be able to use that. If they get sick because of coronavirus, they can use the new leave hours that we just gave them so that they don't impact their existing sick time and can be on the same level playing field with all their other teammates. Next, I want to talk about Medica. Medica has donated $200,000 to nonprofits here in the state of Nebraska in response to the coronavirus. I want to thank Medica for stepping up, being one of those great corporate citizens that is recognizing the pandemic that we're in and helping Nebraskans out. They're going to be giving to 9 different organizations here in Nebraska, including the Nebraska Farm Bureau, Charles Drew, Food Bank of the Heartland. Again, thank you, Medica, for being able to help out Nebraskans in this emergency. We really appreciate it. Next, yesterday I made a comment about gym clubs, and I want to clarify what I meant yesterday because we got a lot of questions about this one. What I was talking about is if you have a gymnasium where you charge to bring kids in to get those gymnastic lessons, you can do that at, again, keeping to the 10 customer rule we talked about before. However, that does not cover other club sports. So if you're in the other club sports category, those things are still not permitted until at least May 31st. So if you're calling in because you had a question, you heard gym clubs and somehow I can now do my club sport, no, you can't. No, that's still not prohibited until we get to at least May 31st. And then the schedule for this week is, again, English briefings at 2 o'clock Central Time. For the rest of the week, we've got our Spanish language briefings at 5 p.m. on Tuesday and Thursday, and then I will be on NET again Thursday night at 8:30 p.m. Dennis Kellogg, speaking of Nebraska, so tune in there to see that. And so, Zoe, thank you for being nice enough not to make me try and do all that from memory. I appreciate it. All right, so we're going to jump into some of the questions here that we've received in. We got a bunch, so I'll try to move through those pretty quickly so we can get to questions here in the room. Andrew Ozaki, KETV, I talked to a representative from the League of United Latin American Citizens today. He is calling on the governor to require food processors to follow all OSHA COVID guidelines and hire more OSHA inspectors to make sure guidelines are being done. How much of that is being achieved with inspectors from health officials touring packing plants, and also call on Meatless May to bring attention to the situation. And OSHA is a federal program, so you need to go talk to your federal government about that. And with regard to meatless meat, I cannot support that in any way, shape, or form. Look, meat is a part of a healthy diet. We are working to keep our meat processors open because meat is an important part of a balanced diet. Would you consider making OSHA COVID-19 guidelines mandatory and enforceable at meat packing plants? Again, this is a federal issue, you need to go talk to them. Consider hiring more inspectors, federal issue, go talk to them. Do more testing on all food processing facilities. We are actually doing that, so we are working with the food processors to be able to do more testing. In fact, right now, I believe we are up in Dakota County to be able to help do more testing up there. William Padmore, KLIN, are gyms covered in the upcoming health measures? So gyms were always allowed to be open, health clubs and so forth, with the 10-person rule that we talked about and the social distancing guidelines that you have to have at least 6 feet apart between workout equipment. So again, social distancing, 10-person rule, but gyms were always allowed to be open under that. And again, practicing all the other good hygiene stuff like sanitizing and all that sort of good stuff. Melanie Standiford from NBC Nebraska is asking, people in Lincoln County feel they've earned the right to have their small businesses open as originally planned on May 11th with continued precautions taken. Is there any chance this will be reconsidered? So the current plan is for West Central Public Health that their DHM they're in right now will expire May 11th. And you can imagine that we would be extending the DHM similar to what is out there already for the other DHMs that have already expired. Many people are asking if medical professionals know if COVID can be spread by mosquitoes. We will have to follow back up with you on that one, Melanie, sorry. Dr. Antone, do you know, is there any research about coronavirus being spread by mosquitoes? You can just answer from there, I'll repeat it.
Yeah, the only thing I know is it's not bloodborne. So
It's not a bloodborne disease, so it seems unlikely. Is that fair?
that's correct.
Okay, good. Do we know if the virus can be destroyed by UV rays from the sun, or are the lights used in hospital environments to clean masks a specialized type of system? Will the sun kill the virus on playground equipment, for example? And Dr. Antone?
The 3-day rule or 2 to 3 days?
2 or 3 days, we think, but if it's left
Plastic
with
and
it,
metals and
2 or 3 days on plastic and metals,
12 to 24.
so even in bright sunlight, it's not going to kill the coronavirus for 2 to 3 days?
I don't know about sunlight, but I know sunlight is good though.
Sunlight is good. Dr. Antone is very clear, sunlight is good. So maybe we can catch that, pick that one up in another briefing.
I know of sunlight killing the virus.
We know of no research that shows that sunlight specifically kills it, but obviously UV lights are being what we use to sanitize some of the masks and stuff as Melanie is referencing. Can you ship hogs from individual farms instead of euthanizing them? You could ship hogs to, say, a meat locker. My understanding is that many of those meat lockers are, well, actually, they're usually very booked, especially during hunting season. But you could certainly check with your local meat locker to see if they would be able to take them. But otherwise, I don't know of another way you'd be able to do that other than going to a local meat locker. Rob McCartney, KETV. What criteria will the governor use to tighten DHM restrictions? And again, this all gets back to, so what we were told a couple of months ago by all the health officials and experts is that the reason we put these social distancing guidelines in place was to flatten the curve, to slow down the spread of the virus. What we were told is it doesn't necessarily change the area underneath the curve, which means that the same number of people may become infected, but you've just spread it out over time so they don't all go to the hospital system at once and overwhelm your healthcare system. So that is what we are managing to make sure we do not overwhelm our healthcare system. So that's the things we will look at when it comes to if we need to start tightening down some of the DHMs. And Dr. Tusha, I liked your idea, your kind of analogy of a dimmer there too. But what we're looking at is what is happening to our healthcare system. So for example, right here in the city of Lincoln, the Lincoln-Lancaster Public Health District, I think as of yesterday, 85% of the ventilators were available. In Omaha, it's like 75 or 78% are available. So you can see that we are nowhere near coming close to using the capacity in our healthcare system. The steps we have taken have been very successful in spreading this curve out and slowing down the spread of the virus, and we've been able to serve people in our hospitals. Reese Ristow, Omaha World Herald. Does the governor plan to work with Mayor Stothert on providing Omaha with money from the CARES Act? I've had conversations with Mayor Stothert with regard to that, and we'll work with Douglas County and the mayor with regard to how that CARES Act may be used to reimburse Omaha for COVID-related response or expenses. Tiffany Heinrichs, Wymore Arbor State. Can you ask the governor what he plans when he plans to allow youth sports to reopen, and if that would be considered with a set of social distancing guidelines, et cetera. So again, those youth sports, we're prohibiting until May 31st. Again, this goes along with what we're doing with regard to schools. The schools are operating without children right now so that we don't have a high concentration of people together in the classroom. Sports, team sports are the same thing, right? It would defeat the purpose of having the kids out of school if they were allowed to play together in a group sport. So we will certainly consider that as we get into May and have more information about how the virus is spreading, what's it doing to our healthcare system. So I'd say stay tuned on that. But again, we're not ready to make any sort of decisions with regard to that now. Christian Wagner, NTV. Attorney General William Barr put out a letter Monday with U.S. attorneys to look out for governors or other government officials who are issuing directives that could clash with part of the Constitution. What do you take on this move by AG Barr? I agree, we should uphold our Constitution. Don Walton, Lincoln Journal-Star. Will you be urging Congress and President Trump to approve the package of federal aid to help states recover from revenue losses caused by the pandemic so they can continue to fund programs and services? I'm not going to be advocating for that. As I think I mentioned earlier in the week, I think a compromise that Don Bacon, I believe, has introduced into Congress would be to allow the current CARES Act money to be able to use for that purpose should states want. I think that's a compromise position, but that's really up to Congress to decide how they're going to handle that. Ryan Boyd, KGFW. Even after speaking with our own local health department this morning, Two Rivers out of Holdridge, we don't have exact numbers on active cases versus people who are recovering. We just have a running daily tally across the state of COVID-19 cases. Does confirmed case number 1 still have COVID-19 compared to confirmed case number 3,300? Well, I can tell you our first patient has recovered. Last I knew, she was doing very, very well. I do not know about number 3,300. Will health officials soon start to have the ability to subtracting and adding numbers to daily totals, or does that take too much work at this time while addressing the pandemic? Again, we would certainly like to start tracking recovered, and I know some health districts are able to do that, and it is a goal to be able to do that down the road, but again, with the other priorities we've got going right now in some health districts especially, it's going to have to be, we get to it when we can get to it. Charlie Brogan, KFOR. Is anything going to be done to merge all these different testing databases into one so that we get a full and complete picture of the entire state, or are we going to end up with a bunch of different pools of results? No, they'll all be pulled together into one pool when we start doing, for example, the test in Nebraska. All those results will be pulled together and distributed together. We are constantly being alerted to be careful about telephone scams. With plans for massive contact tracing, is there any way the public can be certain that a call claiming to be a contact tracer is genuine, as opposed to a scammer calling and asking for personal information such as social security numbers or Medicare numbers? So again, when we're doing this contact tracing, what we're doing is somebody has been identified with coronavirus. We're going back to find out all the people they'd been in touch with over the last 2 weeks to tell them that that person had been in touch or had tested positive for coronavirus, and so they should quarantine. We will not need your social security number. We will not need your Medicare number. We will not need your bank account number. So if anybody is asking you for these very sensitive personal information, that is likely to be a scam, so please don't respond. Sheila Brummer, Siouxland Public Media. 5 mayors in Sioux City metro area put out a statement yesterday asking for more transparency when it comes to COVID-19. There's very little information coming in from Tyson Foods plant in Dakota City, Nebraska. I enclosed the letter. What is government planning to do to help? Sioux City appears to be a hotspot in the nation right now, and Sioux City Mayor Bob Scott is worried our community will be suffering if something isn't done to help in our area of the state. So we put out the data with regard to Dakota County. It is all there on the website, so that gets updated daily. I'd say I just refer you to the Nebraska Department of Health and Human Services website, and you'll see the information for Dakota County. Christina Stella, NET. There are many rumors out there today about operations at Smithfield plant in Crete. Can you confirm exactly what their plan is regarding closing, and what's the plan if they won't shutter? Why did Smithfield reverse course on closing? Well, it sounds like, Christina, you already know the answer to this one. Did you or any of your state senators speak to management after the decision to close, and if so, what did you discuss? What has the local health department's role been in advising whether the plant will stay open? And was the state in contact with Public Health Solutions regarding the reversal? So what happened yesterday is that we received a call from Smithfield executives in the morning saying they were planning on shutting down the plant. We received another call in the afternoon saying they were planning on keeping the plant open. I actually didn't talk to their executives till about 8 o'clock last night. did Smithfield, so that was basically our conversation. They called to tell us that they were closing, and then they called back to say they were opening. And I'm trying to think of what else in here. So what's the plan? So again, what I encouraged the Smithfield executives to do was get Shelley Sweethelm and Dr. James Lawler into their facility to be able to do some of these reviews we've talked about. They've been to 9 facilities so far across the state to be able to help those facilities on how they can do more social distancing within their operations. And so Shelley and Dr. Lawler have been doing that across the state. In fact, they were just out yesterday, or Shelley was at least out yesterday, doing a couple of facilities tours. So we encourage Smithfield to do that. UNMC has also put out their meat processing COVID-19 playbook, which I've also encouraged the executives to make sure they were looking at. I know their local people have been on our calls for the last few weeks with regard to our weekly calls with all the food processors, where we've been talking. In fact, we talked about that last Friday, that playbook specifically. So I brought that to the attention of the Smithfield executives and encouraged them to look at that. We're also going to be doing more testing in Crete, contact tracing, providing the public health department with more of those resources. Again, and similar to what we're doing in other public health districts, reaching out to local community leaders, health clinics, especially folks serving the Hispanic community, to be able to talk to them about how they could help us with contact tracing and testing and so forth, and working together with us to be able to reach the community where English is not the first language. And of course, as I mentioned already, we do our press conferences in Spanish on Tuesdays and Thursdays to do a better job of reaching out. We translate our press releases, some of our social media. We are working harder to be able to reach that community and help them with regard to social distancing in the home as well as in the workplace. So again, the same plan we're using in places like Grand Island or in Lexington, we're going to be doing in Crete as well. And so from Aaron Duffy, the Omaha World Herald, this is very similar. The Smithfield pork plant in Crete told employees on Monday it was going to temporarily close down this week. Now the plant says it will remain open on a reduced schedule. Did the governor talk to any Smithfield executives? Did he intervene to keep the plant open, given his statements about the importance of keeping the food chain moving? So again, they called to say they were going to be closing in the morning. They called back in the afternoon, said they changed their mind to stay open. We didn't tell them to close. We didn't tell them to open. Oh, and getting back to that last one with regard to it, we are not going to tell food processing facilities to close, okay? So that is not going to be something we, the state, are going to be doing. We're working to keep these facilities open because they are a critical part of our nation's food supply. As I've said before, we really need to make sure that our food supply chain is stable so that people can go to the grocery store and be able to buy those meat products. So this is an important thing, mission critical stuff that we got to keep open. Tara Campbell, WWT, is the Smithfield plant in Crete now going to stay open? So I think we covered that one. Did the governor request the company reverse its decision? No, he did not. If so, what are the reasons and what changes were made to help protect the workers? I think we covered all those. All right, so I've still managed to leave a fair amount of time left to do Q&A in here by talking very quickly. So, questions in the room?
Governor, the
Yeah.
cases in Dakota County went from 459 on the state's website last night at 5:45 p.m. to 629 according to the local health district at 1 p.m. today. To what extent, and by my math that's like a 37% increase, to what extent does that reflect increased testing, and how can you help people put these kind of jumps into perspective?
Yeah, sure. So the question was, hey, you've seen a big jump in the number of cases testing positive in Dakota County, and we actually, I don't remember exactly the numbers, but it was 400 numbers, some to 600 some. And how can we put that all in perspective? Well, we are doing a lot more testing up in Dakota County. So we've deployed the National Guard up there, and we expect to do a lot more testing in the Dakota County area to be able to have an idea. So part of the reason for the increased number of testing positives is because we are doing a lot more testing up there right now in Dakota County. And again, what we want to keep in mind for all of this is that it's all about preserving the healthcare system. So as long as everybody can get that hospital bed, that ICU bed, that ventilator, that's what we're working towards. And so we've been in touch with the public health director up there to be able to work to get her more resources, whether it's the testing and contact tracing, which we've mentioned, but also other administrative type of help so that she can manage the situation. So we are working through it. But again, when we go into a place and we dedicate, I think we've got 2 teams of National Guard folks up there right now dedicated to doing testing. we're going to do a lot more testing, which means we're going to get a lot more people testing positive. And then again, the follow-on step for that is to make sure that we go to each of those folks who tested positive, get them to isolate, help them to isolate. So for example, in other communities like Grand Island, where we've implemented this plan, we've got facilities available so that, say, the families of the workers can go isolate separately from the person who's tested positive. So again, we're doing that isolation. We want to work with communities to be able to make that happen, so that's part of our plan. Get those people to isolate, and then go back and do that contact tracing to find out all the people who they've been in contact with, to let them know the person they knew has been tested positive for coronavirus and what can they do to quarantine. So it is part of our overall plan we were using with all of our hotspots to be able to work to get people tested, get them isolated, work on quarantining people, and that's part of how we're going to slow the spread of the virus. But we're doing a lot more testing, so we should see a lot more cases. Yeah, Lee.
You talk about the number of cases at these different action plants, specifically in Crete. You see, I believe, just under 100 in the workers there. Then you do the contact tracing, and that'll spread to how many more workers. And you're asking these people to quarantine. At what point are you concerned that these plants can't facilitate operation because you have, I don't know, 50, I don't know percentage-wise of the workforce that can't go, but you want them to stay open despite the number of people that can't go to work?
Yeah, so Lee's question was, gee, if you do a lot of this testing and contact tracing, could that lead to a situation where these food processing plants have so many people that are either isolated or quarantined that can't remain in operation? And that will be a decision for the company to make. I mean, we're going to do the right thing with regard to the testing and doing the contact tracing to make people aware. But the plan is the one that really has to, the company has to make the decision about what they can do with regard to that operations. But we are going to work with them to be able to keep that plant open, whatever food processing plant that is, and do all the steps I described with regard to the contact tracing, testing, working with local community leaders, providing places for people to isolate or quarantine. All that is part of our overall plan. But it'll be ultimately up to the company to make that decision whether or not they can remain open. Martha.
Yesterday, the Department of Labor put out advice for workers who are getting unemployment benefits now, telling them that if they're called back to work, such as through the reopening of some of these businesses, that if they refuse to go, they could lose their, or they would lose their unemployment benefits. But you also said yesterday that if you were a worker in one of those vulnerable groups, you should not go back to work.
Yes, both those things are true. So the question was,
Are you telling people to not go back to work and give up their unemployment benefits?
no, so the question was, hey, the Department of Labor put out a notice yesterday for folks that if you get called back into work and you refuse to go, you will lose your unemployment benefits. That's absolutely true. What I said yesterday was, if you're one of those vulnerable populations, say you've got an underlying healthcare condition, older or whatever it is, you should work with your employer so they do not call you back to work. So this is, again, a case where you need to work with your employer to communicate to them. Again, one of the things I've always talked about is do a lot of communication. So communicate with your employer that, hey, you're in one of these, they may not know, for example, that you've got an underlying healthcare condition. There's not necessarily a reason for them to have known that. But if you communicate and say, hey, I got diabetes, or I've got this respiratory illness, I'm a vulnerable, one of the vulnerable population. Work with your employer so that that person, the employer, does not call you back to work, and then you'll continue to receive those benefits. But if you have no other reason otherwise to not go back into work and you refuse to go, then you will lose your unemployment benefits.
So it's up to your employer.
So you have to work with your employer on that.
You're at risk of losing your benefits.
So, right, so you need to work with your employer, and of course, there's always appeals process and all these sort of things, Martha, as well. But I think the best thing to do is just open up that lines of communication. Again, we're asking all Nebraskans through this pandemic to do the right thing, to work together with each other, and by and large, Nebraskans are doing that. John?
I have a question on church services, and this actually came to me from a priest. Essentially wondering that once churches are allowed to reopen on May 4th, if, say, a mayor or county in a hotspot, could they override your order and say, no, we're not going to have church services in Hall County or Lincoln or whatever, or does your order supersede anything?
So the question was, hey, we're going to start opening up religious services May 4th. Could a city pass an ordinance to be able to prevent that from going on? And does the DHM supersede the ordinance? I don't know the exact answer to that. I mean, theoretically, I suppose a city could pass an ordinance that would be separate from the directed health measure, and I have to go look at, I don't know the answer to that right offhand. But I think the better solution is just work with your faith community. I mean, one of the things we talked about when we said we wanted to open up religious services statewide is we were weighing the cost benefit of having those services open and being able to reach out to communities in places like Hall County where English is not the first language. So if we can reach the Hispanic community or the Somali community in a trusted source like their church or their synagogue or their mosque or whatever it's going to be, and communicate with them in a language that is their first language, and have those faith leaders do that in a way talking about social distancing, that was worth the cost-benefit trade-off for us to be able to do that. But again, that's going to be entirely up to the place of worship's decision. There may be houses of worship that decide they don't want to do that, and that is absolutely fine as well. So I would say that if you are a mayor of one of those cities and you've got a concern, I would reach out to your faith leaders directly in your own city and start that conversation first before you start going to pass laws or ordinances or things like that, and really work that angle, because I think, again, communication is the key here. When we've had folks, when we've reached out to ask them, for example, to do more with regard to social distancing, people have been very willing to accommodate that and make that happen.
Grant Schulte and Ken Anderson both would like to know, what do you think of the president's upcoming order to keep meat packing plants open? How confident are you that the ones in Nebraska can safely?
So that is Grant Schulte and who else?
And Ken Anderson.
Ken Anderson are both asking, what do you think about the president's directive to keep meat processors open? Again, that's what we've been working to do here in Nebraska. Again, it's something that you have to work at on the ground, right? You have to work very hard to be able to reach out to the plants, to the communities, to work on social distancing and all those sort of things, the testing, contact tracing, all the things we've done. And that's what we're going to continue to do.
But should it be up to the president, or should it be up to you?
Well, again, if the president's got a plan, so the question from Fred was, well, it should be up to the president or should it be up to me? So if the president has a plan to be able to do it, we're happy to work with him on the plan, but at the end of the day, you still have to work to be able to have people in there and do all the social distancing and everything like that, and that's what we're doing right now. If we can get additional resources to do that, I'm all ears on how that can happen.
Julie Cornell is asking, when can massage therapy offices reopen? Are these similar to salons?
So Julie Cornell is asking, when can massage therapy establishments reopen? Again, that would be in line with in those counties that we talked about earlier this week, May 4th, with the proper social distancing guidelines, things such as wearing the masks for both the person who's receiving the massage and the person who's giving the massage. That'd be an example of what's in the directed health measure. May 4th.
Paul Hamill says Adam Morkel is tweeting that the decision to relax restrictions was political rather than medical. Do you want to comment on that?
So Paul Hamill is saying that one of our state senators is saying the decision to relax restrictions was political rather than medical. I would just refer the senator to our hospital data to show that we are nowhere near overwhelming our healthcare system, and that in the places where, like say Hall County, for example, where we have lots of cases and the hospital is handling them with a lot of hard work, that that hospital, CHI St. Francis, for example, will not be able to do elective surgery, and that Hall County will not have the loosened restrictions as we've talked about for other parts of the state. So I refer to the center to actual data that we've got on our website.
Both newspapers in North Platte are asking about the letter the North Platte Chamber sent to you about reopening on May 31st. Did you want to comment on that?
So both newspapers in North Platte are asking about the letter that the Chamber sent me about reopening on May 31st. I'm not sure where that May 31st deadline came from. West Central Public Health is, DHM expires on May 11th, so I don't know where May 31st came from. They're on schedule to have a new DHM May 11th when the old one expires. Okay. Martha.
Can you talk about how your approach to this compares to the herd immunity approach that a couple state senators brought up? Because it sounds like what you're saying is similar as long as the healthcare system is not overwhelmed.
So Martha asked, gee, it sounds like your plan is like the herd immunity plan. And I would say, well, the herd immunity thing is not a plan. That's do nothing. We are far from not doing anything here in the state of Nebraska. Just ask my team. They've been working very, very hard, a lot of hours. So again, we are doing things such as ramping up the testing, which we expect to get to, the next few weeks, 3,000 tests a day on top of the 1,000 tests a day now we're doing for the last 7 days. We've been doing over 1,000 tests a day. For the last 5 days, we've been doing over 1,200 tests a day. The folks at the Nebraska Public Health Lab have really just been working incredibly hard to be able to pump out that many tests. We are expanding our contact tracing. So we're going to be going up to 1,000 people doing contact tracing. Danette, our CEO of DHHS, Danette Smith, has a plan to get us to 325, I think, by the end of this week. We've got a couple of teams already stood up, and they are working to assist with our public health districts on that contact tracing right now. So we're really, again, expanding both the contact tracing and the testing. We've gone out and purchased a tremendous amount of PPE, and I gave you those numbers yesterday. Something like 1.127 million gloves were distributed, 1.353 million N95 and surgical masks. So again, we've stocked up on PPE, 45,000 surgical gowns. So these are the things that we've been able to stock up to be able to help make sure that our healthcare providers, our first responders, volunteer firefighters, you name it, have the proper equipment to be able to protect themselves. So we're taking steps on all these areas to be able to expand the kind of things we're doing with regard to working with local public health departments, local clinics, having conversations with, the CEOs of hospitals, of the long-term care facilities, of the meat processors. So again, working on all this with regard to best practices on how you can do the social distancing. We are looking to make sure that we are covering all our bases on how we slow the spread of the virus. Our measurement on determining success is the healthcare system. 2 months ago, all the public health experts said, again, the reason you do this, you can't necessarily change the number of people who are going to get infected, but you can spread it out so that you don't overwhelm the healthcare system. That's our measurement, is making sure that all the things we're doing end up in that final goal of not overwhelming the healthcare system so that everybody who needs that hospital bed, that intensive care unit bed, or that ventilator can get it. And we are successful at doing that. You look at Hall County, and Dr. Anton, do you happen to have the numbers for CHI St. Francis off the top of your head for today?
As far as how many are in the hospital?
Yeah, how many folks we got in the hospital, and how many ventilators we're using, and how many ICU beds?
I was just there yesterday and saw it firsthand that they have 34 patients in the hospital right now.
So they got 34 patients that are coronavirus related
Yes,
in the hospital. Their capacity is about 130 or 140.
that's right, 140 is their census.
Yep.
Capacity. 13 are in the ICU, 10 on ventilators.
13 are in the ICU. They've got 16 ICU beds. 10 are on ventilators. I think they've got 20 ventilators they could use, right?
They do, they have
15, 16 they like to use within the ICU beds, yeah.
convert their other 4 into ICU.
But they could convert 4 other rooms into an ICU, so they got some flex capacity there. So even in a county where we have got double the amount of cases of even our largest county, Douglas County, we've been able to manage the healthcare system so that everybody's getting that healthcare they need. That's really what the whole goal that was laid out to us by these public health experts 2 months ago was about. Don't overwhelm your healthcare system. That's why I focus so much on that.
DeLon from KTV is asking when Nebraska is expected to reach its coronavirus peak.
So DeLong from KETV is asking when we're going to expect to reach the coronavirus peak. Well, if you go on, look at like the IHME thing, it's a moving target. They keep pushing it out. But again, it gets back to what we're really focused on is what are we doing to make sure we preserve our healthcare system, just as I just described. And if you look at just statewide right now, we've got between 40 and 50% of our hospital beds, ICU beds. We've got about 77%, I think was the stat today, of ventilators available. I was just looking at the stats I mentioned today. In Lincoln, it's about 85%. In Omaha, it's about that 75%. So in our biggest metropolitan areas that have, about half our state's population in those areas, we've got tremendous capacity available in the healthcare system.
Don Walton wants to know when you plan to talk with the mayor of Lincoln to discuss how to proceed in Lincoln.
So Don Walton wants to know when am I going to talk with the mayor of Lincoln to decide how to proceed with Lincoln. We've had those conversations already with the mayor of Lincoln and also Pat Lopez, who's the public health director here, and you can expect an announcement tomorrow. Do you have anything else, Heather?
Gavin Higgins from KCNI Radio wants to know if people will still be able to deliver or pick up alcohol after the DHMs are changed.
So I'm sorry, Gavin
From KCNI in Broken Bow.
Gavin from KCNI in Broken Bow wants to know, will you still be able to pick up alcohol and have delivery alcohol? And the answer is absolutely yes during this emergency. That is a statute that I waived, so that will be ongoing throughout the course of the emergency. John.
With the expanded testing in Omaha and Grand Island, with the test in
So the question was, when is the Test Nebraska expecting to get up and running? We have to get our lab up and running first so that we can make sure we can process those tests. So I would say stay tuned on when that will actually start. But again, we want people, especially in Omaha and the surrounding areas, and Grand Island and the surrounding communities, to be able to sign up at testnebraska.com. Again, fast, easy, information is confidential, and that's what we'll use to schedule this testing. Yeah.
Do you expect any type of meat shortages here in Nebraska with less people working in these meat plants at times?
So am I expecting any sort of meat shortage here in Nebraska with the slowdown in the meat processing area? And I got to tell you, I have not paid attention. My wife is the one that's been going to the grocery store, not me, so I can't tell you what's going on in the meat case. But that's, again, why it's so important that we work. This is mission critical to keep our food processors open here in the state of Nebraska, because it's who feeds us, it's who feeds the nation. Yeah.
We've had some county fair board members reach out and ask if there's any sort of protocol or discussion about what the summer might look like in county fairs. Is there any sort of?
So there's a question about what the summer might look like with regard to county fairs. Again, we'll really get back to how the virus is progressing and what's it meaning for our healthcare system. But you can imagine that we're going to be doing social distancing throughout the course of the summer and fall at the very least, if not through the end of the year. And that there will be limitations on the number of people that can get together in groups, for the next several months. We're at the 10-person rule through the end of May. I can't tell you what it's going to be in June, but there'll be a limitation in June. There'll probably be a limitation in July and then probably one in August. So again, we're going to take this a step at a time. We're going to open it up a little bit, like I described yesterday with the speed limit. We're trying to find that right speed. We're going to take it up a step at a time and see what happens, and then we'll take the next step. So I can't give you a prediction, but certainly you can imagine that all these large public group gatherings will be impacted somehow this summer. Yeah, Lee.
In terms of not wanting to overwhelm the healthcare system, is there a concern that there's a financial burden on the people that cannot afford to go to hospitals in those underprivileged communities that you see not overwhelming the healthcare system because the COVID patients are staying home and self-treating just because they simply can't afford to go?
So one of the question was, are people that maybe don't have insurance or are low income are not going to go and seek that health care, and they're going to try and stay home and treat and so forth. Nobody's going to be turned away because of an inability to pay. Everybody's going to be tested. It's not going to be any cost. The insurance companies have said that. CMS for Medicare and Medicaid have said that. So, and we will work with the community leaders to make sure that everybody knows they go to the hospital and they will get treated for coronavirus. This is not going to be something where you have to worry about being able to pay.
We have another question from Paul Hamill. He has a reader question, basically saying, are we concerned about the rising number of cases in Omaha? Is this changing your mind about lifting restrictions there?
So the question from Paul Hamill is, we've got more cases in Omaha. Is this changing my mind with regards to what we're doing with regard to Omaha? And the answer is no. I think we had 46 cases yesterday in Omaha. And Fred already pointed out we had way more than that in a very small community of Dakota County, and we're not, running into issues there. Hall County has got more than double the number of cases as Omaha. We've been able to manage the health care system there so that everybody, we just talked about those numbers. So again, if you think about 46 cases in a metropolitan area of 823,000, relatively small. Now, we want to do more testing there because what we may find is there's people we're not catching, and we want those people to isolate and all the people they've been in contact to quarantine, so we can do a better job with regard to getting people to stay home if they've been impacted. But right now, if you look at the healthcare system in Omaha, we are nowhere near capacity, reaching our capacity there.
We have time for just a couple more questions.
Okay, a couple more questions. Yeah, Martha.
Have you gotten any results from the Test Nebraska assessments yet? I understand that they were supposed to do some reports as far as, the risks and the number of people who had symptoms and so forth.
So, yeah, so the question was, have we received any reports back from the testnebraska.com from the standpoint of just doing the assessment and seeing what are the risks out there? I have not seen any of those reports. I'm not saying they haven't been compiled, but I haven't seen anything with regard to that. I'm not sure any reports have been run yet. I think, well, I'm not gonna speculate. So I haven't seen anything yet. But again, what I would expect is that's also gonna inform us on when we start getting those test results in and how do we match those up. Yeah, John.
I have a question for maybe it's you guys, but dental
Great.
offices reopening. Mainly, like, what's
Dr. Kraft, Dr. Tusha, you want to talk about the PPE recommendations and the new dental guidelines? You're going to have to come up here and talk about it, though. We can't hear you from back there because the microphone's here. Thanks, Dr. Tusha.
Oh, you're welcome. Yes, we're going to be, in the past, you've probably been going in and you see masks and gloves. We're also going to have face shields. Those are available out here at Innovation Campus, as well as other vendors. And also head covers, some type of something to cover the hair. And then also gowns if we're doing a aerosol procedure.
And just one more for you. Have you heard from any dentists that are reluctant to open up maybe because they have underlying health conditions or anything like that?
I'll repeat the question.
Okay, he's asking if we've heard from any dentists that have underlying health conditions who might be reluctant to open up. We haven't heard of any of that, but each practitioner has to make his own decision, his or her own decision, because we're allowed to open up, but it's not a mandate that we have to open, and we really feel like each practice has to make their own decision with their team involved.
Well, thanks again, Dr. Tusha, and thank you again all for coming out here this afternoon. I very much appreciate it to hear what the state is doing to slow the spread of coronavirus here in Nebraska. I want to say thank you to all the Nebraskans who are working hard to practice those social distancing guidelines, that good hygiene, all of it to slow down the spread here in the state. It is absolutely working, so thank you all very much. Again, a reminder, 5 p.m. Central Time, we will do our Spanish language press conference, and then we'll be back here again tomorrow at 2 p.m. Central Time, and then Thursday, for the rest of the week at 2 p.m., and then Thursday, we will have Spanish language broadcast or press conference again at 5 p.m. Central Time, and then 8:30 Central Time on NET. Thanks again, everybody. Have a great afternoon.